everyone, so I'm going to explain our PRF hair restoration. So we have lots of patients that have hair thinning for one reason or another. Female pattern hair balding, male pattern hair balding, it might be thyroid related, it might be just general aging, a ton of different factors. So how do we make it better? We do something called a hair restoration bundle, where I combo it with PRF injections and topical drops that you go home with. So PRF is platelet-rich fibrin. So I actually draw your blood, collect it in these little tubes, spin it down in our wonderful centrifuge. It separates the blood cells, and I collect the platelet-rich fibrin from that, and then I inject it back into the scalp. So I inject it into the areas that are balding. So it depends on the patient. It may be in the scalp, anterior scalp. It may be throughout the hair. I mean, I've seen it all. I've seen little patches. Wherever that is, we inject it into that. Patients are always like, Candice, does it hurt? Actually, it's quite comfortable. I use a vibrating tool that distracts the sensory perception. I also use a cooling device that makes it very, very tolerable. The whole procedure itself, I draw your blood, takes about 5 minutes to spin down, not very long at all. Inject your scalp in about 10-15 minutes, something like that. And then you go home with these prescription drops that get mailed to you by the pharmacy, and then you put those drops on morning and night, and that continues the results of this. Typically we do it in a package, so you see me once every month, well, every about 6 to 8 weeks, for at least 4 treatments. And then if you buy the bundle, you get a 4-month supply of the drops. Usually lasts a little bit longer, probably about 6 months, but we call it a 4-month supply. Yeah, so that about explains it. You start seeing results typically in about 6 to 8 weeks. So whenever you come back for that second treatment, you're starting to see some results, because that's how long it takes to get through a full hair growth cycle. All right, my dear, it's gonna be a little poke. How's that? Any discomfort at all?
No.
Not too bad.